Welcome to the Remarkable Dentist Podcast with me, Fred Joyal, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to another episode of the Remarkable Dentist Podcast. I'm Fred Joyal, and today I'm talking with another remarkable dentist I know, a good friend of mine who runs this phenomenal practice up in a very competitive part of California, up in Silicon Valley. He's in Los Altos, and he's very big on cosmetics and implants and teaches it. He's got an amazing client base. He has multiple practices that he works out of and operates, and a phenomenal team with a great culture. So we're going to talk about all of that. Joe, welcome to the podcast.
Fred, thank you. I mean, it's an honor to be here, be able to chat with you, my friend, and be part of your creation.
So you have a practice that is primarily what you would call it a cosmetic practice, wouldn't you?
Absolutely. I mean, the name of the practice is Peninsula Center of Cosmetic Dentistry. So that's our focus. Even I have several associates here who are amazing dentists as well. And even when they're doing general dentistry, the focus is always in high-end cosmetic, top-line materials, et cetera.
Yeah. And of course, we're going to get into the technology that you use and some of the training that you've gotten into. But what got you into dentistry?
Well, funny you ask. So I know your brother's an engineer, right? I was studying mechanical engineering in undergrad, and that creation and design, and we're working at AutoCAD. That stuff was really interesting to me. And then I was planning on going on and getting an MBA because I really want to be on more the business side of engineering development. And then after my first year of undergrad, I went and spent a couple years in Colombia as a service volunteer for my church. And while I was there, I was introduced to a group called Operation Smile. And to be part of that and see what they were doing and the impact they had on people's lives, as much as I like computers and designing, it's not going to be life-changing for someone for what I could do, whereas this was. And so when I got back, I shifted my focus. I knew I wanted to be in healthcare, and dentistry just incorporated all my skills and interests into that one profession. So it's been a nice fit for me. So you found yourself down in Colombia, yeah,
doing that. That's rather fascinating. With your church group, which is, and we see this all the time. Dentists are going all over the world, and I think you saw. Wow, this is an amazing skill to donate. I tell dentists all the time, you don't have to donate money, donate your skill. It's a much greater, more long-lasting gift.
Which I still do. I mean, we do it locally here. We do Smiles for Troops events. And then I've gone internationally in Costa Rica, Mexico, Guatemala, Belize, doing volunteer dental work because it's a huge service to provide for people.
Yeah. And when you do it for the vets in particular, because they're not always getting ideal care,
right.
And to be able to improve their health at that level, because they're not going to be able to afford the work that you can do for them a lot of times. So that's a wonderful thing to do. And we know a few organizations that do that are all doing, particularly vets, but a lot of them are just doing charity dentistry. My personal dentist, he does a day a month in his practice that he just donates it to. He decides 5 or 6 patients that just need the care and can't afford it, and he said it's his favorite day of the month, which is
it's incredible. We're so lucky. We're so blessed in our career and our field, as you know, and to be able to offer that to other people and be able to provide a service. It helps us feel better about the work that we do and feel the value that we bring to people's lives. And as you mentioned, I mean, dentistry can be very expensive, and not everyone can afford to have a healthy smile, healthy teeth, and that's life changing.
So give me the dimensions of your business at this point. How many team members, chairs, that people want to know, like how big are you? Like what's the enterprise?
Yeah, I have 3 practices and a dental lab. And so 2 of the practices are located here in Los Altos. My main office that I predominantly work out of, the Peninsula Center of Cosmetic Dentistry. And then a couple blocks away, we have the Mid-Peninsula Dental Specialist practice, which is a multi-specialty office. So we have perio, we're working on endo. We have oral surgery, pros there. And so they're able to do interdisciplinary care and really service the needs of dentists locally and then within our group. And then in the neighboring town in Mountain View, I have another practice, incredible team there, 3 clinicians. That's a bigger office. It's 12 chairs in that office. They do incredibly high-end work, a lot of holistic dentistry, TMJ type treatments. In my main practice, it's a small office, kind of a boutique office. We have 6 chairs. There are 3 doctors. We have a nice rotating schedule. We have double hygiene every day, so we make a small space work really well and efficiently. Being in the Bay Area, it's not like my friends in Texas that can have these 20 offices that I'm so jealous of. So we learn to be very efficient with the space that we're given. And then the multi-specialty practice, same thing, kind of a smaller boutique office, 5 chairs there. We have the specialists coming through and multiple team members that help support them. So it's pretty neat. And then underneath all that, I have my dental lab. Currently in the lab, we have, I think, 13, 14 employees. It's fairly large at this point. You kind of, the lab world's an interesting business, by the way. It's just a whole different niche into itself. And you either keep it really small with like 2 people, or you have to grow it big to be able to afford all the technology and the CAD and all the things that we really use in dentistry today. And so that's the direction we've taken the lab.
So what is that point that you realized that a lab was a solution? We'll talk about how great a solution it is, because I think people kind of get that, but we can talk about it. But there must have been a moment where you went, I need a lab. And then was it a 2-stage rocket where you went, I need a lab. And then you went, I need a bigger lab. I need the checked out lab.
It kind of, there's transitions to that process. So one is, you look at what we were spending every month in our lab bill, right? Which was astronomical. And then there was the lack of quality control that I was seeing on the lab side. And especially for what I do with cosmetics and implants, I'm so dependent on the quality of that lab work and the consistency of it. And so that was really the bane of my existence was, man, I need predictability. I want to have, I don't want to say I'm a control freak, but I want to have some control over what's being done and how my work's being done on that side. As a dentist, I can do perfect preps, perfect impression, perfect temporaries, everything set up perfectly. And if the ceramic work doesn't match that, it's a failure. Right. And so those 2 things were really the initiators of that process. And then I had a really good friend who is a very talented ceramist, ran his own lab. And so I approached him with the idea. I said, hey, why don't we partner up? Let's do something bigger. He had a very small boutique operation. So let's do something bigger, be able to really provide a higher level of service, predictability, have capital to be able to get all the fancy equipment you need on the lab side. And so that was, 6 years ago, maybe. And I love my partner in the lab. I tell him this all the time. The lab business is a terrible business. It's not a money-making business. I spent a lot of time and effort on it. I've never received any profit from the lab. It's all reinvested in the machine there. But for me to have control over the aesthetics and the results that I'm getting on the ceramic side, that's priceless. It's worth that for everything we put into it.
And of course, you're going to be able to finish a case quicker.
Oh yeah. Sometimes I push them a little too hard there. They say, hey, I need this day. And they're like, really? I'm like, yep.
Yeah, I started her this morning. She's waiting, for the 22 units, wrap it up, So, yeah. Now, so give me a rundown of the other technology that you have, in the facilities.
Yeah. So again, going back to what I was telling you with my interest in, going into mechanical engineering and experience with AutoCAD and CAD design, et cetera. For me, the dental side of that was awesome. I mean, I went to dental school at USC, and we had the Patterson Center there. So they had, this was back in 2005, 2006. They invested a lot of money in technology there. We were exposed to CEREC and starting the CAD CAM stuff. And for me, I was like a kid in a candy store. Like, this is awesome. I love the digital technology. And I went through the evolution with, the red cam and then the blue cam and the OmniCam, now the Prime Scan, and just seeing those improvements with each iteration was super fun. In addition to the CAD with CEREC, all my offices have the iTero machine. We have milling machines here in the office. We have the cone beams. Everything's digital. I do a lot of my cases, most of them, with the cosmetic stuff, using the DSD technology, digital smile design that Coachman puts out, designing things on my iPads, showing it to the patients, doing digital mock-ups for them. I couldn't imagine my career without that. And certainly, as anyone that plays with digital technology knows, digital technology is great until it isn't, right? And so there's always some little hiccups and bumps in the road and things in development. And for me, though, being basically kind of in control of both sides on the practice side and also lab side, I think helps smooth out those bumps significantly. But it's a great tool for us. It really is. And the accuracy we get, the results, it just speaks for itself.
Now, do you find yourself taking impressions at all at this point, or are you fully digital? Or are there times when you're going to take impressions?
The only time we still take impressions is when we're doing full arch implant cases. And there is technology out there for doing digital scans for full arch cases. There's two technologies in particular, and those are on my radar. I probably would have pulled the trigger. Yeah, I probably would have pulled the trigger last year if it weren't for that little hiccup we had with
the flu that went around.
The flu, that put a little hitch in our giddy up. But with that being said, that's something that we're going to be implementing here, because I think it's been around long enough to prove itself as far as accuracy goes. And as you know, with these full arch implant cases, there's zero tolerance of error. And so you need to be real accurate there.
So let's talk about that, because I think that's become a significant part of your practice, especially in one of the offices in particular. But so these full arch things, you're talking about all on 4, all on 6, stuff like that? Or
exactly, yeah. And that's, again, I was pretty lucky at USC. I worked with a prosthodontist there named Harel Simon, who my last year at dental school kind of took me under his wing, and I helped TA the course that he runs there on full arch implant reconstruction. So I came out of the gate with a pretty good foundation on that technology and also the protocol, clinical steps. And for me, it was so cool. I mean, to take a really hopeless situation, whether they're already wearing a denture or the teeth, they're not going to make it, to go from that to a fully functional, fixed, beautiful looking restoration. I mean, that's cool stuff. How can you beat that,
Yeah, that really changes things for people. And there's a tremendous market for it. There's so many denture wearers there at this point, and that's not going away. And it can be affordable, reasonably affordable to do all on 4s rather than, individual implants. And so it tends to have.
Sorry, I was going to say, especially if you're efficient with your processes, and how you do things on the clinical side, you can do things at a very reasonable price, and from our standpoint, still make it worthwhile for the practice, right?
Yeah, and I think the lab is giving you that as well. You've added this whole leap in efficiency and efficiency in delivery time and accuracy, which just makes it possible to make it more affordable. And that's the basic business is if you can deliver the same quality at a lower price, you're going to do more business, which means you're actually going to produce more in that with the same at a lower price. You're actually going to make more. because you're using your time more efficiently. And not redoing stuff is huge. A lot of dentists totally discount the idea that they're doing redos for nothing, right? Essentially. And if that's stacking up, if that's the average is 5 or 6% of the work is redone. And you can't charge for it, or you can't figure out how to charge for it. Sometimes you'd like to, because they're a Bruxer or something like that, and they're popping off veneers as fast as you can put them on.
Right.
But generally speaking, that's clock time that you don't get to charge for, and that's expensive.
Well, and when I teach on this topic, one of the things I caution clinicians on, you hear, Clear Choice is one of the bigger names out there for this procedure and protocol, and I'm grateful for Clear Choice because they spend a whole lot of money on marketing to raise awareness for this treatment, which is, I think, good for everybody, us and the patients, et cetera. But what we're seeing happen in the industry, in this specific marketplace, is everyone is it's a race to the bottom, as I call it. So everyone's pushing to do things faster and cheaper, and they are compromising on materials a little bit, they're compromising on healing times, whatever the case may be. And it's a very short-sighted thing to do. And so there are, tried and true principles and things that need to be paid attention to, for it not to be something that's going to fail in a year, 2, 3 years, and then it's a nightmare, right? And so I caution clinicians on this. I say, look, do it right. There are efficiencies. There are ways to do it very profitably and use the best materials and deliver the best product for the patient. But we're being driven in a direction where corners are being cut, and we're going to see the ramifications of that, and it's not going to be pretty.
Yeah, as you say, redoing that work is way more serious than a crown that didn't fit exactly right, or a temporary that popped off or something. Right. This is bone loss and grafts that need to be done later to fix it. It may not be reparable at a certain point.
It's catastrophic, and then you're going like zygomatic implants and pterygoid implants, and you're just grasping at straws, and it's. Yeah, we need to do right by our patients. Obviously, there's a business aspect to this, but we got to be patient-centered in what we're doing in our approach, materials, et cetera.
And that's a communication thing as well, is to effectively help the patient understand that this is a long-term investment. This is the equivalent of a hip replacement. This is, putting mechanics in your body to make you stronger, and it's meant to last ideally the rest of your life. If it doesn't, that's not a good thing. It's when it fails, there are repercussions in this. So anybody who's cutting corners on these things is not doing a benefit to that patient, and so we as me as a marketer and you as a dentist have to get really clear on the downside of going the cheap route.
Right. Well, and early in my evolution as a practitioner, one of the hardest things that I had to reconcile is the fact that really everything we do is going to fail, right? Everything we do has a lifespan, and if it outlives the patient or not it's very dependent on the patient. And so knowing that when we do these procedures, whether it be a crown, veneers, full mouth reconstruction with implants, we're effectively resetting the clock. Right. And we do everything we can to make sure that clock's as long as it can be. But we're doomed from the beginning. There's going to be failure. There's whether it be biology, disease, mechanical, there will be a failure. And if we are doing it in such a way that we've made a very short clock, that's not a win for anybody.
Yeah, because the patient behaviorally is going to shorten the clock enough. I remember a dentist just mentioning casually, he says, I'm doing full set of veneers on somebody, and 6 months later, they're starting to not look good. 3 years later, they're really starting to look good. And I realized the reason they needed veneers in the first place is they didn't even believe in brushing their teeth. So he says, I'm not going to get anywhere near the lifespan out of my veneers. They're going to have gum recession, right? They're going to be, seeing all of the margins appearing. in a few years on these veneers instead of a few decades or something like that.
And so that's an interesting point to differentiate us from. We're not tooth mechanics. We're health professionals, right? And so as part of whatever treatment we're doing, our modalities, health training is part of it, and helping people understand how to be healthy and how to take care of, this investment or whatever we're doing for them. Even as simple as Invisalign and orthodontics. Well, we got to explain retention, right? We got to talk to them about, okay, this is a commitment now. Otherwise, we're going to just shift back to right where we were. And it's as simple as that to what the maintenance looks like on these full mouth implant reconstructions. And if we're not doing that part of our responsibility, we're shortchanging our patients.
So you told me an interesting story that I think patients would love, because there's always, speaking of the weirdness of patience, you had something that happened today that has never happened to you before in your entire career of dentistry. How long have you been practicing?
It's going on 14 years.
Yeah. Okay. So give us the blow by blow on this one. This is beautiful.
So beautiful lady referred to me from another local GP, which is not uncommon for cosmetic work. Simple case, just doing 4 veneers. That's all she really needed. And we're at the delivery appointment today. And so I go through my typical routine of, trying everything in, make sure it fits perfectly, make sure I'm happy with the aesthetics, etc. And then after I kind of check off on them, I'll leave the room. My assistant's there with the patient, give them the mirror. They can go look in daylight outside, whatever they want to do to feel comfortable with where we're at. So went through that process. I come back into the room, and
this is before you cement, right?
Before I cement, they're held on.
You're positioning them. You're looking. This is the finished veneers.
Finished veneers, final veneers, yeah. So they're just tried in with this try and paste. It's kind of like a gel, just to kind of loosely hold them in position and simulate the color of the cement. And so I come back in. The assistant goes, "Oh, she wants to go and have her general dentist take a look and sign off on them." And I kind of looked at her and I'm like, "Wait, what?" And she's like, "Oh yeah, I already called over there. She's available to see me, so I could just head over there. I'll be back in like 30 minutes." And I'm like, "I'm actually not comfortable with that. She can come here, that's fine, but I don't want you. These will fall off. They'll hit the ground. They'll break. We're starting all over again. These are beautiful. I've never had this happen. I've never had this conversation before. I'm really uptight about this." And she's like, "I'm sorry. I just can't make that decision without her input." And I said, "Well, she referred you to me because she's relying on me doing this for you." And she's like, "I know, I just can't do it." And I said, I knew I wasn't going to win. I said, "Okay, if they break, you're on the hook to buy new ones. So just be mindful of that. Be very careful." She's like, "Oh, I got it. I'll be careful." And so she heads over. The general dentist calls me and it's like, "I'm so sorry." I don't know. She's like, "They looked awesome. Great job. I don't know what to say." And so she comes back in and she's like, "Okay, yeah, I'm good. Let's go ahead and bond them on." And she's like, "Thank you."
At least you didn't swallow one on the way back.
Oh my gosh, the things going through I had to mentally check out. So this is just going to be a recipe for disaster.
People are strange.
People are people. My biggest regret at this point in my career, and it's not too late, but I wish I would have kept a journal and just document, there's just stuff that happened, and you just kind of look back and you're like, was that real? Did that really happen? And there's part of me that just is fine flushing it and not ever thinking about it again, but maybe for my posterity's sake to have these experiences written down.
Yeah, well, you got to, when you're sitting with other dentists and they're going, I got one better than that. You got to be able to come up with one, and you're going to have this. You're going to be able to pull this right out, and they're going to go, "Oh, wow. Okay."
And the nature of what I do, and I get sent, I call myself the backstop with dentistry sometimes. I get sent things that, the other dentists or whatever, like, I just can't deal with this anymore. And I do sedation, so I get a lot of anxious patients. And I definitely have my fair share of stories.
So what do you think, what would you call your biggest goof along the way? If you could pin it down.
Man, there's a lot. I'll tell you the one that's front of the mind right now. And that's been my slow development and utilization of social media for my practice. And this is something, I mean, I remember you talking to me about a couple of years ago, and it's nothing new. I have some personal bias against social media. I'm just not a fan of it personally. And so I let that leak into really what was best for my practice in the business of what we do. So I'm playing catch up now on that, right? And so that's been something that I'm currently dealing with. That was a mistake on my part, where I just was slow to adopt social media and what we were doing.
Now, on the other hand, you have been very quick to adopt teledentistry.
Yeah, we jumped on that right away. And I actually had been doing a little bit of that pre-pandemic. And then when the pandemic hit, right away, I said, we got to find a better way. We got to find a way to connect to people in a safe setting and connect to them quickly and do it efficiently. And, all of us were hit financially by this pandemic. And so looking at ways of doing things more efficiently, more cost effectively, certainly is a benefit. And I knew that it was something that if invested in and set up properly for our practice, it wasn't going to go away. This could be something that we're going to use now from here on out, which it will be the case. So I rolled it out. I was ready to go probably in April. Our office was still closed. Technically, we had already started doing teledentistry consults. And so that's been a big thing for us. And for me, and what we talk to our team members about, et cetera, getting over the fear and anxiety of how do I read a person or how do I connect with them when it's done via teleconference or video conference, that took some work and that took some training. But I did on Monday 7 virtual consults. And if I tried to do 7 consults in my office, my staff would hit me. That would be hard to, kind of put all those pieces together. Whereas doing 7, virtual consults like this, very simple.
Now, are they converting basically at the same level, or is there a loss ratio to the virtual consult? I would think there would be, but you're expending a lot less of your time.
The way I describe it, I'd say we made the top of the funnel bigger, right? So we're able to kind of get more volume in the top, and then we're able to refine it down better than we could based on a telephone call, et cetera. And then what we're getting out the bottom of the funnel is much higher quality than what we were getting previously. And so part of that is, as good as our front office staff are, as good as we go with training with them, and you and I have been involved with fortune management and training team members for answering phone calls and doing things, as good as they are, I can do it better. I can talk to a patient better about what they're doing. And their response to the doctor is going to be different than it will be to a team member, right? And so that's why I believe in this model. And I believe that the little bit of investment on our end to do this properly generates a higher quality lead. And so when they actually do come in the office, the conversion rate's like mid to high 90s. Right. And I'm not talking for like crowns or fillings. I'm talking for big, procedures, right?
Cases, yeah.
Smiles, makeovers, implant reconstructions, full mount video, that kind of stuff. So it's the small amount of effort, time, and cost on the front end to have a much better experience in the back end. Because, and I was talking to a plastic surgeon buddy of mine, and I said, why aren't you doing this? Like, this is a no-brainer for you in plastic surgery, right? You have the video conference, you're talking to, especially if it's a facial type thing, facial aesthetics, et cetera, and that's their specialty. You're able to get really good information. They're able to connect with you. They're able to get a read on you. You get a read on them. Is this a good fit for everybody? They come in pre-sold, right? It really is the now and the future of what we do. And all of my associate doctors are doing it. They're doing it for, pain, broken teeth, Invisalign consults, whatever the case may be. The only one of my team members that's a little bit slower to adopt is my periodontist, who's been doing this for 30 plus years. He's like, I kind of do it the way I do it. Like, okay, fair enough.
Yeah, there will always be the late adopters.
Late adopters.
But you've really taken this and run with it. And also, I think people are going to want to know what software you're using if you're happy with it. And are you doing smile designs with the software itself?
Yeah, so I'll talk about my evolution there. We've done, like FaceTime and Zoom. I still use Zoom a little bit. I'll get into that. But we're using a software called Podium, which we use for, patient texting and communication, inter-office communication. And they have kind of a FaceTime HIPAA compliant secured model within the platform. So that works really well. You just text the patient a link. You're able to engage and connect really quickly. So that's good for kind of the general stuff. For my cosmetic stuff, I use a program called Smile Virtual, which was created by a buddy of mine in Arizona, Brian Harris. And so that is nice. It has a little extra layer where it's not having to be done directly. And so what I mean by that is when I'm scheduling these virtual consults, it's still like if I'm running long on my procedure and I got this consult to do and there's the stress of, okay, I got to get there on time and all that stuff. So the Smile Virtual platform, what I like about it, it's more of an on-demand type setting. And so, the patients will click on it, they'll upload, the photos we ask for, they'll put in what they're looking for, their requests. And then when I have time in between patients or, whenever I choose to do it, I can then hop on, I can answer their questions, I can give them pricing information, and then I'll record a video to address what their concerns are and give them my recommendations. That gets sent back to them, no pressure. They kind of review it. They now have pricing information. They have some general ideas of options. I tell them, of course, it's dependent. I got to have x-rays and full exam to really know for sure, but it gives them kind of ballpark. And if they like what they're hearing, like what they're seeing, then they can click a button there and request an in-person consultation. So that's been neat.
And then they're talking to you. And I think that a lot of dentists aren't realizing that this is the beginning of building trust with the patient. Trust is not like this analytical, factual calculation that people make. It is all impressions that they have about someone.
It's emotional.
Yeah. And so when you're talking to them in this initiative, you're taking the time with them when it's convenient for them. They don't have to come in the office. They don't feel any pressure to actually buy. It's like they can just go and you're gone, right? So all of a sudden they're safe to open up about what they want. And you can just talk about it, but you're being the healthcare professional available to them. It's incredibly powerful. I know dentists are not adopting this as quickly as they should. It's certainly accelerated radically since the pandemic started because people figured out I got to do this even for emergencies and right. Make it possible for my patients, at least for me to diagnose them without them necessarily having to come in. Because a year and a half ago, you couldn't give away teledentistry. Dentists would go like, you need to see the patient.
Yeah.
Right? It's like, and of course, and this is a classic example of a limiting belief, right? We were so attached to this idea that you need to be physically in the room with the patient in order to get case acceptance or even, to start the relationship. No, you don't.
And I 100% thought that. I mean, that's how I rolled. I'm like, I gotta be face to face with them. I gotta have all my clinical records ahead of time. I gotta do my thing, my spiel, and bring up their photos and just kind of go through this whole thing with them. And I thought I can't do it any other way. And so I really challenged myself to that limiting belief. And then once the opportunity of the pandemic came along, I'm like, well, now it's time to give it a try. And, the days you talked about kind of where we are in dentistry in the beginning here, the days of the doctor in front of your name automatically equating trust and a yes are gone. Yeah. They're gone. They want to know you. Who are you? What are you going to do? And why are you different? And that dovetails even with the social media side of things, which again, I was slow to adopt. And I had a hard time kind of opening that part of me up to my patients. And you really got to put yourself in the consumer's shoe. what would you want? How would you want to connect to the person doing this work for you? And, you're going to spend X number of dollars with, and you're having this committed relationship with. You want to know them. You want to know what you're getting into. And I think, medicine is adopting to this. I think even like you look at the big conglomerates like Kaiser, whatever, they're creating more personal experiences now for their patient base. It's the way that things are, and it's definitely the way things are going to be moving forward.
Yeah, because of course, along with social media is the whole review world. They can read what other people think about their experience with you. They can go on Yelp. They can go on Google reviews. They can see how many people are willing to write something about you and write something positive about you in some sort of detail. And they're going to use that. I mean, that is reflexive at this point when people are making all sorts of decisions, not just a dentist, but a dinner. So that this knowledge is out there. And I tell people this all the time. I said, your reputation is being built out in the world, whether you like it or not, or whether you control it or not. So why not step in and control it? Because it's happening. Dentists used to say, I don't do Yelp because I think they're wrong. I think it's an evil company or something like that. It's like,
which it is, but you got to do it.
Right. And it's like, I don't debate that with them, but I said, sometimes you got to pay the mob in order to keep people from breaking your windows, so it's also that from a consumer standpoint, they look at it as a very, very useful tool to learn about you. And they want to learn about more what the experience is of being a patient of yours when they go on Facebook. What's that practice feel like? And then Yelp, it's like, what do people say about how they were treated? They were fairly charged? Was it explained properly? All of that stuff that exists out there, and you can either use it to your advantage. And I'm working with you on your marketing right now, and you're doing all sorts of really good stuff. You do get great reviews. But the thing that you have most when I analyze your practice is that the majority of your patients are coming from word of mouth.
Right.
And that means the experience of being a patient of yours makes them want to talk about you. That's what I mean by remarkable, is they can't resist telling other people what a great practice you have, what a great, not just you, but everybody in that practice. And there's a culture that you've created, and I'm a big believer that people have a sixth or seventh sense, or whatever the number is at this point that you're at, that about how some place feels.
Right.
They'll walk into your practice and they will feel a certain way, and that's trust as well. If they're starting to feel comfortable, they're starting to feel safe, they're starting to feel like they could probably trust you. That's happening on a subconscious level for a lot of people, but you've created that. Now, how do you think, what helped you create that?
That's honest. It's easy. It's easy to say this, but for me, it comes down to the golden rule. I mean, how would you want to be treated? And so everything we do, and I analyze all of our systems, and, we have regular meetings with all of our team members, and as busy as things can get, you can never lose sight of that. Of if you walk in the door, how do you want to be treated? What do you want your experience to be? What do you want the smells to be that you smell? What do you want the feels to be that you're feeling? What are your eyes seeing? How is the staff presenting itself to you? How is the doctor presenting itself to you? It's every little detail of what would you want. And that's different for different people, right? And so what I want to see when I walk into a place may not be what other people want to see, but my practice is going to reflect what I want to see, right? This is my world, my universe. And so we are devils in the details on that. And even beyond, what that initial experience looks like, all the interactions, if anything ever goes wrong, how is that handled? How are we showing appreciation to our patients that are loyal to us and, part of our raving fans? It's all of that. So I wouldn't say this is a hard concept, right? But what happens is in clinical practice, as you know, you get busy, right? You get busy and you got, hygiene checks and you're late for this patient, and just the wheels never stop turning, and we're all people. We all bring our own things with us, and there's always, things to work through, et cetera. And so it's easy just to sit back and just kind of let the machine kind of do what it's going to do and be reactionary rather than actionary. But the key to this is regularly focusing on what is this experience like for people, and removing those glasses of I've been here for a decade plus and it's just kind of everything's whitewashed, but looking at it very objectively. And I'll give you an example of a recent kind of example of this. So I was doing some filming here in my office recently, and we were doing some work. I'm in my consultation room. We were doing some filming in the consultation room. And I have this really cool Apple monitor here that when I first got it was like a big deal, right? Because, it's really expensive and it looked really good, et cetera. But it's like 12 years old now, right? And I've just kind of left it, and I'm like, it's a cool monitor, right? Well, that's what's looking like vintage rather than cool, and it's a little smaller than what the new ones are here. And so when we were doing this filming, I was looking at things through a different lens, like through the camera lens. How are things looking? And that monitor jumped out to me. And I'm like, that's not okay. Like, that's not what I want to have reflected. It's a simple thing, right? It's a monitor, but it's those little details that I pay attention to that what I believe make the difference.
And one of the things that you are now doing is actually you're using a PR agency to start to promote your practice. You do some high-end magazine advertising. You, of course, do Google ads and some Facebook advertising. And you have a terrific website. I'm going to put your website in the show notes so people can see how it's done. There is the perfect balance of before and after explanations of procedures and that very, very modern look and feel. And of course, right there on the site is the teledentistry button. Would you like to connect with the doctor?
Anecdotally, Fred, I just finished that. So during our shutdown, that was one of my projects, was redoing the website. Well, I'm not even a year into it. I'm already redoing it again. So I got some other ideas there. But anyways, you got to pay attention to that.
Well, and that's it. You can't get many dentists get trapped in the sunk cost idea. Like, I just paid $6,000 for this website. I got to make it run 5 years. No, the $6,000 is one good case. Okay. Why wouldn't a much better website get you 5 good cases? If you're doing 7 teledentistry presentations in a single day, the people want to interact online. Okay. I don't need to hear any more than that. If one dentist can do that in a single day, the appetite for it is enormous. And so use this medius. This media is not costing you anything to run. It costs you to build it. It's like, that's the beauty of it. It's like you buy a car with no maintenance. It's like until you buy it's like a fully warranty covered car that you get every 3 years, because you're leasing it. Think of your website that way, where you're, how is it communicating? How is it communicating now? How that online behavior evolves all the time because everybody's using all sorts of websites and people are always gaming that system and figuring out how to get people's attention. You can't have a website that looked like it was built 6 or 7 years ago or was. No, that's not how people use websites anymore. That's way too long ago.
And I'm not a fan of the boilerplate website either. It's really like I said before, it needs to be a reflection of your personality, of your vision, of what this practice is. I mean, it really needs to be personalized and customized because that sets the tone for people. I mean, most of the time that's their first point of contact. That needs to set the tone of who you are and what they're going to expect from you. I'll go back to your PR question. So again, as I was kind of diving into our systems and what we were doing when I had all this time on my hands last year, one of the concepts that I was thinking of, it's the whole, if a tree falls in the woods and no one's around to hear it, doesn't make a sound, right? And so it became pretty clear to me that hey, we're doing some pretty cool stuff. We have some things, going our way. What are we doing about letting people know about it? And there's all the, internal marketing efforts that are great and need to be part of what you do. There's the Google stuff, et cetera. But for me, it was really a concept of, I think we can do better than that. And so I reached out to a PR firm and kind of went over what I was looking for, what my ideas are. And they said, that's fantastic. I think that sounds great. The double-edged sword with doing this is you have to, be comfortable really putting yourself out there. Because you're putting yourself out there not only for the good, but the bad and the ugly, and opening yourself up to more scrutiny, et cetera. So you got to be willing to do that. And two, you got to be willing to put the time in, because even though you're hiring this firm and they're doing a lot of legwork for you, there's a lot of time commitment on your end to fill in the gaps and do interviews and write articles. And if you're not willing to do that, then it's kind of a waste of money. So
no, it is not a set it and forget it a marketing approach. You have to make it work. They have all the tools to make it work if you give them the right content and the direction and the guidance. And also, this is about attracting the right patients. So you have to craft what you're going to put out there, and they will help you put it out there. So yeah, really good point. One last thing I wanted to talk about is the value of coaching that has affected your practice over the years. I want you to talk about that a little bit.
Yeah, I think, as I go and lecture other dentists and involved in study clubs, et cetera, one of the things, and this isn't unique to dentists and dentistry, but as business owners, we really get blinders on, right? And so we're kind of going down this path, and a lot of times it's maybe a path of least resistance, but it's what we're used to, what we're comfortable with, and that's just what we do. As things get thrown in our path, we're just going to rely on the same tools that we've always used. What I've found with bringing in coaching, which for me has been a huge thing in the involvement of my leadership style, my business, my practice, my team involvement, is they're able to see things from outer space, right? So they're not down in the trenches in the weeds. They're looking at things way up above. They have lots of other reference points and other practices and other models to compare to. And they'll say, Joe, what about this? So you're doing this, that's great. Have you thought about this? And maybe this might work for you. It's a huge resource. I mean, I see people kind of balk sometimes at the cost of doing coaching or bringing in a consultant, et cetera. And it reaps dividends every time I've done it. And I've worked with a few consultants and coaches over the years, most recently with Fortune Management. And it's, huge increase in what we're able to do. And the other thing that I really enjoy about it is I can't be everywhere at once, right? And so especially, with 4 kids, and I do have a life outside of my businesses and my practice, to have an extra set of eyes and hands and people involved in training your staff that you don't have to be there 100% of the time, that's money well spent. And so I'm a big fan of coaching. It does open up our eyes to things going on in different ways. It gives us opportunities to get better. I've certainly been challenged in that process, and they hold me accountable to things, and it's helped my growth and development. So I'm a fan. I mean, I think it's a no-brainer for us, because not many of us went to business school. Not many of us got training on running a practice and running HR departments and knowing how to, handle some of the drama that comes our way, and to have that help is without price.
Yeah, I think that's what dentists who use it experience is they say, I don't have to figure everything out myself. And a good coaching person or team has resources that tap into what's going on in hundreds of practices and can tell you, I know you think your case presentation percentage is really good. It's below average.
Yeah.
Well, how can that be? It's like, because, and I'm going to listen to you, and I'm going to listen to your presentation. I'm going to tell you. And all of a sudden you bump your case presentation up, forget a big number like 20%, bump it up 5%. more acceptance. That's life-changing in a practice. And honestly, most people, you can take them up 10 or 15% just by somebody listening, because you can't hear yourself what you're saying. Case presentation is a life skill.
Yeah.
And so it's all of those things that make the difference.
And I'll tell you, it's analogous for us, like what we're able to do to change people's lives with the dentistry we do. Coaches do the same for us, right? They change our lives. They make our lives better. It's a powerful, powerful thing. I've seen it obviously in my practice, but I've seen it in others, and I've been part of that process. It's incredible. And it's just silly not to think of, I can use some help. That's just a stupid place to come from. Come from a place of, I want to be coached. I want to look at better ways of doing things. I can do things better. Why not?
Yeah. I mean, you're never going to hear a high-end athlete go, we won the World Series. We can finally get rid of our coaches. What? Nobody would say such a thing. But anyway, Joe, I so appreciate your time, your dedication to excelling in this profession, and how much you care about your patients. I think this has been really valuable for people to see what can be done if they just keep evolving their practice. That's really what I want people to see with a remarkable dentist like yourself is.
And Fred, I got to tell you, one of my first dental business books I read was yours. So I read your book in dental school. And so I appreciate your efforts, what you do for us in dentistry. You're one of those coaches that I'm referring to that change lives. So I appreciate you doing this.
Thank you very much, Joe. And so to everyone out there, there'll be stuff in the show notes. And as always, as a podcaster, I ask you, like it if you're watching it on YouTube, subscribe to it if you're doing it somewhere else. If you like it, even if you don't like it, subscribe anyway, because that makes me think people like me, and that's good enough for me at this point in my life. But in the rest of the time you're out there, keep being remarkable. Thank you, Joe.
Thanks, Fred.